Superintendent General of the Eastern Cape Department of Health is no longer on the line with us, so we're not able to speak to him, I understand. So we do apologize for that. We will go back to him. So I understand he is there. Okay, let's speak to Eastern Cape Department of Health's Tobile Mbengashe. Thank you very much, Dr. Mbengashe, for joining us. What do you know about the story that we just heard from our colleague Aviwe Mtila about these test kits that were found on the road by a jogger?
Yeah, look, I got to know about it just about this afternoon, and then I inquired from the laboratory service about what happened. And the laboratory service, obviously, they say they're investigating, but what apparently happened was that they've got a lab, mobile lab in the King Williamstown. That lab was supposed to be dispensing and dispatching lab tests to Port Elizabeth, and then they had a courier which actually take them from King Williamstown to East London to PE for the testing. It does seems to me then the whole incident happened during that space. So they are investigating with the courier exactly what happened. But what subsequently happened is that the manager from King Williamstown went to pick up this test. So they were counting them, trying to figure out exactly what happened, and with the different samples, so that they can assess, what happens to the samples. Are they still, viable? Was there a problem or something like that? So it's something that we don't know. Obviously, from where I'm sitting in terms of the whole COVID program, is that it's a very unfortunate incident, because it really creates a lot of uncertainty to communities about what happens to their test results, and it actually undermines a very critical program, the one of testing, because we use testing in order to tell people that they are COVID positive and also to advise them about isolation and quarantine. So I'm very concerned. I'm going to be given a report about exactly what happened.
And that's just it, right? So we encourage people to go testing, and the test kits are found mysteriously on the side of the road. What does this mean for the specimens that were found on the side of the road? Would they still be able to test them?
Yeah. Now, when I last spoke to the National Laboratory Service colleagues who was in charge onto this, they were actually examining those tests, looking for the viability of the test, because what's important, of course, these tests are actually transported in a particular way. They have to be kept in a container, avoid direct sunlight, so that because the viruses are really viable entities inside that, so they do need to be really protected. So they will be telling me from their side about how many of those tests are still valid or non-valid. And then I think we'll take it from there. Unfortunately, I'm unable now to say whether those are viable or not, but what is important for us is that our protocols for quality assurance and making sure that whatever we do with our tests meets the national standards and the safety of those tests. And so what's very important now is to establish what really caused this and deal with the courier system. I don't know which name it is, and try to understand exactly what actually happened.
You mentioned that these tests need to be kept in a particular way and they need to be protected. According to the gentleman who found them, who was telling my colleague Aviwe, they were in a black plastic bag. He opened some of them using his foot. What does that mean, especially for people, should something like this, touch wood, ever happen again, we find ourselves in this situation? Should people be handling those specimens, or should they be handled by experts?
They must be handled by experts. These are what is called biohazards. It means that they are very infectious materials that should really be held by anyone because of the danger that they could actually transmit the infection. Because those viruses into those specimens are really elements that can still have the capacity to infect someone, and therefore if someone sees that, they mustn't touch it. They must report it to the police and really make sure that no one actually touches it, because it is a bio. It can transmit infection. It can create a problem. And again, it's an extremely unfortunate. I mean, in the manner of how the transportation, in terms of the courier system that we use, we actually try to make sure that we keep the cold chain, the consistency of where the tests are done, put into their proper packaging system, packed properly, covered if they need some ice, and then transported in a sealed, pack. They are not supposed to be in a plastic bag. So they are supposed to be in a sealed container, which is, heat resistance, and it's almost like a cooler bag. That's what the procedures requires, and that's how it's supposed to be done.
According to the gentleman that spoke to my colleague, hundreds of these test kits were found at the scene. There are hundreds of people, which means, in my simple mind, that are waiting for their results or who are thinking that their specimens will be tested and they'll know their results within 24 to 48 hours. Yeah. What then is the process to track those people, to let them know what is happening and to get them to retest?
Absolutely. You're quite right. Obviously, people who come to test in our services, their expectation that their results will be out within 48 hours. So what then the lab, and this is what they were telling me now, we'll have to go through those specimens, assess viability of those specimens. If any of those specimens is not viable, we have to be openly and honestly go and speak to the individuals, tell them actually what happened, and be able to offer them the same testing again. And again, we need to really strengthen our system. I think if it's a problem that was occurred through the courier system, I would really find it a very stringent way of dealing with it. It should not have happened, and it's actually extremely irresponsible to make that. And what is me and us as well as the people who are actually doing this work is really the credibility of our system. Patients need to feel credible and confident that once they've done the test, we will keep the chain and make sure that the results come back them, either positive or negative, depending on the condition. The lab will come back to us, and they promise, and we should probably know by end of business today what is the situation with those tests.
You rightfully mentioned the issue of credibility. Already we are struggling with certain perceptions that, well, COVID-19 is something that's really not there, or it's something that is not for me. So when you talk about strengthening the system, what sort of comfort can you give people who do go get tested that a situation like this will by all costs be avoided?
Yes, I think what's important, this is really to the credit of the people of the Eastern Cape. To date, we've done many tests, and we've been able to provide people with a timely result of their tests. And I think what's important now is that we need to be very open and transparent. Tell people what actually happened and make some correction. And if someone has made a gross mistake like this one, and then consequences must take place. I think what's very important as well is that we have been doing this testing, and really this is our first incident. It's an unfortunate incident. It should not have happened. What we are expecting to do, and this is something that probably the protocol system from national laboratories, together with their partners, the courier system, and together with the mobile laboratories, to make sure that that chain is not broken. The quality is maintained, the cold chain is maintained, and the results are actually going where they are. And again, this is important that, when such a mishap like this one, we need to come clean. And there should be no hidden things. And if the tests were not tested, we must tell people that they were not tested and really explain that we need to do the test because they were done because there was a reason for the person to be tested.
Just finally for us, Dr. Mbengashe, in terms of the process itself, how long do you envisage that this will take, and we'll get an update in terms of what has happened?
Yeah, look, it's an urgent matter. It's a serious matter. When I spoke to my colleagues at national laboratories, they treated it as such, and they were actually doing the counting, the testing, and the assessment of the viabilities. My expectation is that national laboratories will issue a statement, and then will also provide us a guidance, and the team that we're doing testing, which is a national laboratory testing team, they will work with our tracing team, and if these individuals need to be found again, we will actually go and look for them and make sure that their tests are done. So it should not take more than 24 hours. So tomorrow we should know what happened. And, even if there's still further investigation, but we should go beyond the preliminary results of knowing where the problem happened, where the tests were actually, how did it come to be there, how the courier lost them, and what was really the situation, and how many were there, and how many people were affected, and so that we can go ahead and go in and notify those who need to come back. My hope is that some of the results, some of the tests are still viable, and therefore people would not have to redo the test. But I think if it's important for the test to be done, I would really urge those that have been called back to go back and do the test. And it's a very important step in their lives to know what is the status if they were found that they were at risk of getting COVID-19.
Sorry, Dada, before we let you go, it's also not a cheap exercise. So one assumes that perhaps people will not have to pay again when they go get tested again.
Yes, no one would pay again, and I think the key thing, obviously, the test in public service is actually free to the individuals who test. And you're right, they do cost. An average test costs about 400 rands in public sector, and it can go as far as 600 to 800 in the private sector. So these are not really cheap things. And again, the tests are really meant to provide the service, and they are meant to actually identify people. They are meant to make people who are sick to be known what's their problem so that they can get a treatment. So I think there will be a cost, but there will be no cost to the individual themselves, whether it's public or private, because they are not responsible for the problem.
Superintendent General of the Eastern Cape Department of Health, Mr. Thobile Mbengashe, joining us on the line there for those details. Thank you.